Every day we see more tents under bridges, more families living out of cars. And while the problems seem insurmountable, the solutions are simpler than you think. We share the real stories and the real solutions of homelessness, what works, what doesn't, and how communities like ours can do better. I'm Baron King, and this is Give Me Shelter. So I often get asked, are we making any progress in the fight against homelessness? And that is a very challenging question to answer, and I'll tell you why. Yes, we're making progress. Every day, every week, we're getting people housed. We're helping people improve their employment situation. My organization and thousands of organizations like mine across the country are making progress. But our progress is more like what I would describe as whack-a-mole, that arcade game where you hit the little gopher that pops up, and as soon as you do, another one pops up. And so while we're making progress getting people housed, what we're also seeing is more and more people falling into homelessness. And so the title of this episode is Strong Headwinds for 2026. We are trying our best to read the tea leaves and look at what's in front of us because we know the current situation of homelessness, and we're trying to look ahead and see, are things going to get better, the same, or worse? And so that's what this episode is going to delve into. Just to give you a little background, we are, based on 2024 numbers, at the highest level of homelessness in America historically. 771,000 individuals experience homelessness on any given night in the United States in 2024. That represented an 18% increase over the previous year and a stunning 40% increase in family homelessness. So those are not encouraging numbers. So why is homelessness increasing? Number of factors. We're still not building enough affordable housing at a rate that's going to satisfy demand. Wages have been fairly stagnant over the last decade. And when you compare the increase in rental and mortgage costs over the past 10 years versus the stagnant wage increase, you get a gap, a cost to income gap that keeps getting steeper and steeper every single year. So when we look at the agencies, the organizations that are in this fight against homelessness, many of them are nonprofit organizations, such as the Chat Foundation. And some people just don't understand how nonprofits work. Nonprofits are a really great idea. The government, federal and state governments recognize that there's a lot of human needs out there, and they can't and don't want to establish agencies and departments to try and solve every problem. And so a system's been devised where organizations like mine get certain tax benefits that we can pass on to donors. If you write Chat Foundation a check, and we would love that, chatfoundation.org to make an easy donation, then you will get from us a letter saying, hey, Bill Smith gave us $1,000. And Bill Smith can use that document to write $1,000 off their income tax. And it's a way of shifting tax burden to get some relief on your federal taxes, your federal income taxes, and then benefit an organization that's doing work that you believe in. And so that's a really great system. On top of that, nonprofits have the ability to apply for grants, all sorts of grants from the federal government, from state government, local government, municipal governments, as well as charitable organizations and other foundations. And so that's what our organization does. We ask the public, our generous supporters, for money on a regular basis. We also apply for grants where we can receive a significant amount of money that can go to help us provide homeless services. Now, think of the federal, state, and local grants kind of like a faucet, okay? Money typically flows into the state from federal sources. So we work with the state of Tennessee and periodically get grants, and a lot of those grants find their source at the federal level. So Tennessee receives money from the federal government. Tennessee decides we're going to split it up in these different buckets to help these certain causes, and then money flows to us. There's always a rigorous reporting process to show that we're not engaging in waste, fraud, and abuse. You've probably heard those terms a lot over the last 2.5 years. We try and do our best to help people that need help, alleviating the federal government and the state government of actually having to do the work themselves. So the federal government really decided to jump in with both feet on this issue of homelessness in 1987 with a bill that was called the Stewart-McKinney Homeless Assistance Act. And it was designed to generate monies that would go to keeping people housed, keeping people safe, getting people rehoused. And so that money flowed into a lot of different buckets back in 1987: emergency shelter, transitional housing, job training, healthcare, educational support. And it also created the United States Interagency Council on Homelessness to coordinate federal efforts. Now, as is the case with most government programs, when different administrations come in and go, these resources are either increased or decreased. Certain programs are added, certain programs are cut. And so the state of federal assistance for homelessness as it exists now is a lot different than what it was in 1987. A lot of the tools that we have used to combat homelessness have been eliminated, leaving us with fewer levers, fewer tools, fewer ways to really help people. And so now as we wrap up 2025, we've really just had a really significant change with our federal administration. It's no shock to anybody. There's been a lot of talk in the news that the current administration wants to rid the federal government of waste, fraud, and abuse. And I've always been fairly fiscally conservative, so I'm a big fan of eliminating waste, fraud, and abuse. But let's keep in mind that just eliminating programs doesn't guarantee improved efficiency. And here's what I mean. If I was the principal of a school and your children were coming to my school, and I felt like, boy, we're not being efficient here at the school, we can increase efficiency here, I'm going to lay off half the teachers. As a parent, would you think that that would make the education of your child more efficient? If I ran a hospital and I decided, you know what, we're going to lay off 50% of the nurses and doctors and administrators here, do you think your service would get more efficient? And I'm going to say, for most people, I think you're saying the answer is no, and I would agree with you. Efficiency doesn't necessarily increase when you reduce expenses or reduce investment. In fact, in my 35 years in management, what I've noticed is when we try and achieve efficiencies, it usually requires some type of investment. What do I mean? Like investment in new technology, restructuring personnel, things like that. But efficiencies don't typically happen just by cutting funding. And so this talk is probably going to cause you to think about what's going on in our country. I'm looking at this through the lens simply of somebody that works in homeless services and looking at that pipeline of support that typically flows from the federal and state levels down to organizations like mine. So there's two things that have happened in this past year. One is the DOGE cuts. As you remember, at the beginning of this administration, a new department was formed to improve efficiencies. And that had some impact on the pipeline that flows to us. And then this summer, the Big Beautiful Bill, as it's called, was sweeping changes and reforms to current funding platforms. And so we're going to talk about those because keep in mind, the people that we work with are struggling, and there's also a good amount of Americans that are living right above the poverty line, right on the poverty line, that may be housed, but are highly vulnerable to falling into homelessness. And so we're going to take all that into consideration. So one of the big things that we saw was cuts to funding at the Veterans Administration. As you probably know, veterans, when they return from service, struggle to reacclimate into society. It takes them a while to get their feet underneath them, and unfortunately, many of them fall into homelessness. The cuts that were announced earlier in the year and now really were in the reduction of staffing services. One of the things I've been hearing for decades is the VA provides really important services, mental health services, physical health services, housing services, but one of the big problems has always been long wait times, long lines for service, and just not enough people to help those programs run smoothly. Currently, the federal government is proposing a massive layoff of 80,000 employees at the Veterans Administration. So, how does that impact homelessness? Well, the VA is tightly connected to HUD, and they've had some of the most effective programs at getting veterans housed. I believe that if we start making mass cuts to the staffing in those areas, not only is that going to affect the medical services the veterans rely on, but also housing services. So that's a concern. That's a safety net program that feels like it's going to get worse instead of better. All right, let's talk about the changes at HUD, Housing and Urban Development. This is the organization, this is the government office that really focuses its efforts on creating affordable housing and creating support programs for those that have fallen out of housing. The proposed DOGE cuts that some have been implemented recommend that the staffing at HUD be cut up to 50%, and that the field offices close. Well, currently the field offices are still open, and that's really important because when organizations like mine have a question or we need assistance, we have to call the field office. If our 3 field offices are closed in Tennessee, that's going to make it more challenging for us to get answers, for us to effectively work with people. In addition, the HUD, through the most recent program that was just unveiled this fall, is moving away from permanent supportive housing and more into a treatment and transitional housing approach. If you've seen my earlier episodes, I'm not the biggest fan of permanent supportive housing because I don't think it works well for every single person. It's just one tool for all. And, you know, folks, have you ever bought a one-size-fits-all anything? It usually doesn't fit everybody equally. And that's what we have with permanent supportive housing. However, it's the most valuable tool we have, and it's being replaced by transitional housing that requires participants to engage in treatment programs, and some are requiring up to 40 hours of treatment a week, which is an astounding number. What the federal government wants to see is, hey, we believe, erroneously I might add, that all homelessness is caused by mental health issues and substance use issues. So we're going to require people, if they get support, that they're going to have to go through rigorous treatment programs. We already help people get services, but here's the thing. Homelessness is not driven by substance use and mental health issues. It's a factor, but it's not statistically significant enough to require people to go through that much treatment, and there's nothing in these provisions that tells us who is going to pay for the treatment. So it's a poorly organized program. We're recording this here on December 19th, and this new program was set to go into effect in just a couple of weeks until the federal government pulled the proposal for this program. We don't know what's going to be reissued, but the National Alliance to End Homelessness says the changes that are in this HUD bill will put 170,000 people currently in housing back on the street. So when I talk about the headwinds for 2026, we've already talked about 2. We're talking about removing important safety net programs for veterans, and we're talking about making radical changes to a program that was already struggling that is going to have a net effect of putting 170,000 people back on the street. Keep in mind, we're already at 770,000 Americans that experience homelessness on any given night. So some of these changes have the ability to push homelessness to a new record low of nearly 1 million individuals. And I'm not excited about that. Some other changes in this HUD program are requiring states that do outreach services, which means having teams of support personnel going to remote encampments to work at people where they're living in the woods or in shelters or abandoned buildings to coordinate with law enforcement. And it also prioritizes funding to states that have criminalized homelessness. The rationale for this hasn't been explained in these funding documents, but there's really two approaches, it seems, that are on the table for homeless services. One is to use law enforcement to solve the problem, which it doesn't, because law enforcement can't get people housed. It can only arrest people, incarcerate people, and give people a bigger criminal record, which can remove them from consideration for housing vouchers. The other approach is to provide robust social services and housing support that gets people housed, stable, secure, and then starts to work on improving the qualities of life through programming, through treatment, through services. All right, you've heard of SNAP cuts. Well, you may probably don't read everything about SNAP, but SNAP was at the forefront of the budget impasse that happened last month, where SNAP payments were going to be withheld unless the Congress could agree to a funding bill. But prior to that, DOGE and the Big Beautiful Bill have significantly cut $230 billion from food assistance programs. So how does SNAP work? It's the new name for food stamps. Basically, people that are living below the poverty level will get a certain amount of money into an account that they can use for food. It's not a lot of money. We're talking usually it's about $150, $160 a month. And if you have a family or even if you're a single individual, that's not sufficient enough for all your food needs. And so, again, we have people that live in our housing program. They're living there on vouchers that have no ability to have income on their own due to physical disabilities or other issues. And their ability to have sufficient nutrition has just been undercut. And this is going to affect potentially 600,000 households nationwide. So again, recapping, VA cuts, HUD cuts, SNAP cuts. But we're not done. Medicaid is facing an axe. There's this idea that we're providing medical coverage for people that really can go out and get medical coverage on their own. Or we're providing it for illegal immigrants, which is untrue because you have to prove citizenship to receive Medicaid. But we have individuals that Medicaid is their only source of medical care. And when that's cut, these folks are going to be forced into a situation where they're unable to pay for medical care. The Big Beautiful Bill cuts $1 trillion of Medicaid support over the next 10 years. One unseen or not unseen, but one aspect of this that's not being talked about is there's a number of hospitals, specifically in rural areas, where a significant amount of the people that get services are under Medicaid. When Medicaid is cut for these individuals, that income stream to the hospitals will also cut. And so we're going to see the closures of a lot of rural hospitals, which is going to cut off care for everybody, whether you're insured or not insured. Okay, so I know this is a downer, but there's one more area of cuts that are concerning, and that is the Department of Agriculture. How does that affect homeless individuals or people living on the margins? Well, the Department of Agriculture is the single biggest funder for area food banks. Our Chattanooga Regional Food Bank receives significant funding through the Department of Agriculture and is already struggling with the higher demand for food and lower funding. And so When we look at all these cuts, when we look at Medicaid, when we look at VA, when we look at HUD, when we look at SNAP, and we look at Department of Agriculture, I would say that the people that we serve that are either homeless or living on the margins use potentially up to all 5 of those safety net programs. And we're going to see all of them cut all at once. Folks, I hate to be a downer, but this is a recipe for disaster. I predict that this will significantly increase homelessness over the next 3 years, and I'm expecting homeless rates to increase potentially 20 to 25% this year over next year, and that's a scary number. Meanwhile, nonprofits like ours are seeing their funding cut. So we're going to see a higher increased demand because these safety net programs are cut. And nonprofits that are used to relying on government programs to serve these folks are going to be really struggling financially to make ends meet to help everybody that comes to their door. Okay, so we've talked a lot about shifts in government funding. I want to pivot a little bit and say that there's a couple other things that we need to consider. One, inflation is still above 2%. It's at 3%. And a lot of the inflation that we're seeing is in a couple critical areas. We're seeing inflation still hit our food products, largely due to our tariffs, and it's making everyday food items more expensive for those, and especially those living on the margin. Those price increases are significant. But we're also seeing tariffs and inflation hit on building materials. So at the same time, while we're really advocating for an increased building and affordable housing, we're seeing significant increases, 25 to 50% increases in steel and lumber. You can't really build housing without steel and lumber, and we're seeing those go up. So just when we thought we were getting some progress in reducing some of the barriers to creating affordable housing, we're seeing the price of materials go up. That's going to drive up the price of the unit. That's going to drive up the monthly cost. So again, one step forward, 2 steps back. We're also seeing immigration impact housing development. A significant number of construction workers are people that have come into the country either on visas or illegally and have worked in the construction industry. People that I know that are in the construction industry rely on undocumented individuals because typically they work really hard for their wages. And when that labor force is removed, then they find that they can't staff at the levels they need to, and they can't staff at the dollar amount that they need to be profitable. So all these things are conspiring to make affordable housing creation more expensive and more difficult and slow down the flow. So again, not good news. And in Tennessee, there's another reason to be concerned why we think homeless numbers are going to increase, specifically in this state. And states like ours that ran eviction prevention programs. Governments know that it's 90% cheaper to keep somebody in place in their home and make the landlord whole than it is to absorb the cost of having somebody fall out of housing, go through the homeless process, and then get them rehoused. 90% cheaper. So we were engaged for about 18 months in a homeless prevention program, and here's how it works. If you were facing eviction and you had an eviction notice, perhaps you had a transition with employment, perhaps there was a medical emergency, and you fell behind in rent, and now your landlord wants to evict you. The way it works is these individuals would apply for funding to us. We would then get in touch with the landlord and say, hey, we have the ability to erase this person's past debts to you. We will write you a check, make you whole, if you promise to keep this person in their house for 6 months, assuming that they remain current on payments. 95% of the time, the landlords were very happy to work with us, and we would make people whole. We did this for 275 families over 18 months. We spent about $1.6 million to keep people whole, but that money flowed to the state through the federal government, and there's no more money coming down the pipe for those programs. And so while we helped 275 families, this is the sobering news. We had a waiting list of 700 families on our list that we weren't able to assist. Now, other organizations in Chattanooga were doing the same programming, so perhaps you got on our wait list. We couldn't get to you, but you got on somebody else's list, and everything was good. But we still get calls every single day saying, my landlord's going to evict me. Can you help? And we just don't have the funding for it. If we tried using operational funding, we would quickly run out of funding for food and showers and mail service and clothing service and all the other myriad of services that we provide. And so, again, what I want to recap is when nonprofits work effectively, it's because they work with grants, but they also work with government funding. And once that government funding is shut, the options become quite limited. So to recap, and I know this has probably been the most depressing podcast I've put out, but I think it's important. It's important that everybody knows what we're facing. I think sometimes when we just get sound bites on the news or we hear about certain things a little bit here, a little bit there, it's hard for us to really anticipate what's going to be the impact of these changes. And I've just outlined what I think is going to be a catastrophic impact on those living at the margins. We have about 65 to 70% of Americans that are living paycheck to paycheck. We know that there's a lot of people living rent burdened, and we've just stripped away what little supports they got. And sadly, I think we're going to see significant increases. Now, how can you help? As I said at the beginning of this podcast, we're a nonprofit. We are able to take donations from individuals that we will then give you a letter of support, and you can use that letter to remove dollars and cents from your income tax, dollar for dollar. You give us $100, you can take $100 off your income tax. And so whatever you can give, if it's $10, $100, $1,000, whatever you can give, please go to chatfoundation.org. Or if you're not living in our area, find those soup kitchens, find those homeless shelters, find those homeless service providers, support your food banks. They need support. There's plenty of ways that you can jump into this, but the bottom line is the federal government has made choices that are going to reduce services. And if you care about these issues, and I bet you do because you're listening to my podcast, the government has passed the burden of funding onto your shoulders. And we're not happy about that, but we have to make a plea and say, please help us do the work. Please partner with us. It's essential. Thank you. Thanks for listening to Give Me Shelter. If you made it this far in the episode, I invite you to share it with at least one person today, because change happens one conversation at a time. I'm Baron King. We'll see you next time.